So good morning, everyone. Thank you so much for joining us today. I'm Chantal Irwin, the CEO of Arthritis Action, and this is our first webinar of 2021 on arthritis and the COVID-19 vaccine. Today, I'll be joined by our medical advisor and consultant rheumatologist, Dr. Wendy Holden, who will be answering your questions about the COVID-19 vaccine for people living with arthritis. Hi, Wendy, how are you today?
Hi, I'm good. Thank you. Great to see so many people joining us today. I wish I could see a few of you, but anyway, I know you're there. So what we're going to talk about today is all things related to the COVID vaccination, including how it works, the different types of vaccination, various side effects, and we've got loads of questions at the end, which is really, really good. So we're going to talk about vaccination and medication in particular. So all the information that we talk about today is going to be available on our website, which has got a dedicated COVID-19 hub with all the phone numbers that you might need. And the pages are updated regularly to reflect the latest guidelines and advice.
Wonderful. Thanks so much, Wendy. And thanks to all the attendees who have submitted their questions beforehand. We'll be responding to them today. If you have further questions you'd like to ask us during the webinar, please click on the Q&A button at the bottom of the screen and type in your question. Then, time permitting, we'll aim to answer it all at the end of the webinar. If we don't have time to answer all of your questions, then we'll be sure to email you with an answer from Dr. Wendy. We'll also be sending an email with further resources and information after the webinar. We will jump right now into the questions. So Wendy, how do the COVID vaccinations work?
To understand how the vaccination works, we've got to talk a little bit about the immune system and how a virus causes illness. So I'm going to keep this really, really simple because it's so complicated that I had to make it really simple for myself. So hopefully everything will be totally clear. So now what we've got here is a picture. It's not the actual COVID virus, but this is what the COVID virus looks like. So it looks a bit like a football with these little red triangles sticking out of it. And these red triangles are the famous spike proteins that we've all heard about. So what happens with this COVID virus is that it gets into our body through generally through our nose and mouth, but also through our eyes. And the spike protein is the thing that helps the virus to get inside the cells of the body, a bit like a key in a lock. Once the virus gets inside the cells, the genetic information that's inside the football-y bit there gets inside the cell and takes over the cell's own genetic information, and then it uses that to make more copies of the COVID virus. It's a very clever thing. So once it's made the copies of the virus, they then burst out of the cell, killing it, obviously, and then all those copies infect more cells. So that's exactly what all viruses do when they cause disease. For example, that's what causes us to have a runny nose when we've got a cold virus. Now, all vaccines work by helping the body recognize this virus as dangerous or harmful and helping train the immune system to recognize it so that it can kill it. So what vaccines do is that they show the body a harmless part of the virus, and that's called the antigen. The body's immune system recognizes this antigen as foreign or dangerous, and it starts to make these things that we've also all heard about called antibodies, which then stick to the antigen and kill it. So this picture is one of the antibodies, which are the kind of white things in the picture. They're always shown as these mysterious Y-shaped things, which they are slightly Y-shaped, and they're attached to the spike protein, the antigen. Then the immune system will recognize that there's been something going on, and it will then kill the whole structure there, and will kill virus and stop it from attacking the body. So now, in the case of the 3 COVID vaccinations used in Britain at the moment, a part of the spike protein is used as the antigen. This spike protein is injected into the body. The immune system recognizes it, makes antibodies to the spike protein. And so when the real COVID virus comes along with its spike protein on it, the immune system's ready, and it will stop it from getting into the cell. So it's just like the antibodies are just like an army of soldiers ready to go, ready to attack the enemy.
Wonderful. Thanks, Wendy. And what is a live vaccination?
Yeah, that's a good question. So hearing that a vaccination is live is a bit of a scary thing because it makes people think that they're going to get the disease. But in fact, a live vaccination just uses a weakened form of the virus that causes the disease, and it can't actually cause disease because it doesn't have the genetic information that the virus needs in order to multiply, which is what it needs to do to be able to cause disease.
Thank you. Can patients develop COVID-19 from the vaccination?
No, definitely not. So none of the vaccinations contain the information that's essential for the virus to multiply. So they can't cause COVID-19. So vaccinations help the body to get ready in case COVID-19 comes along by getting the immune system primed, if you like. And it's this immune activation that can sometimes cause people to feel unwell or so for a day after the vaccination, but it's not COVID.
That's good news. Does the vaccination have any side effects?
So, well, the good news is most people are absolutely fine and have no side effects at all. And now we've got almost 20 million people in the UK having had the vaccination, and many, many more millions worldwide with almost no serious side effects reported, which is obviously great news. There's a very small number of people who know who they are in general. So they might have already had a serious allergy to one of the additives that are used in all vaccinations, in fact. So they should avoid this particular vaccination if that's the case. So if you've had a serious allergy to a vaccination, obviously ask your GP or speak to the people at the vaccination centre to make sure it's okay. Now, there's a lot of common side effects with the vaccination, and very interestingly, a lot of these side effects were also found in the people who had the placebo vaccination. So more than 1 in 10 people will have things like arm soreness, muscle aches or chills and headaches, and sometimes joint pains. These are usually mild and settle in a day or so, and it's definitely worth taking some paracetamol for just before the vaccination or for a day or so afterwards if you have any of these problems.
What are the different types of vaccination?
Okay, so at the moment we've got 3 currently approved in the UK, but there's more coming all the time. So the Oxford AstraZeneca vaccine is the first one. Was it the first one? Maybe the second one that was approved. And this is based on part of a common cold virus, which is found in chimpanzees. Obviously, this has been genetically changed so that it can't cause any disease in humans. Now, we all know that the common cold virus is really, really good at infecting cells. And so scientists have really cleverly used this ability to smuggle in a piece of genetic information which has got the spike protein in it, which then triggers the body to produce the antibodies against the spike protein. So this vaccination is probably the ones that most people are getting in this country because it can be stored in a normal fridge. So it's much easier to be given in primary care. The other 2 vaccinations, the Pfizer-BioNTech and the Moderna vaccination, are so-called mRNA-based vaccinations, mRNA. And these contain the genetic code or blueprint of the spike protein, which is called mRNA. Once this gets inside the cell, the mRNA in the vaccination then instructs the body to make the part of the spike protein, which then the body recognizes as dangerous. And then again, the body makes antibodies against the spike protein, which are ready when the real COVID virus comes along.
And which of these vaccinations is the best?
Yeah, that's another really, really good question. I'm going to talk a little bit more about the trials for all of these later on, but all the vaccines are very, very effective, much more so than the annual flu vaccination, which is only 40 or 50% effective. No one has actually compared the vaccines head-to-head in trials, obviously, because they're competing drug companies. And which vaccination you will have tends to depend on facilities for storing the vaccination and your local supply. So they are all very effective, and more about that later on.
Thank you. Are the vaccinations safe?
Absolutely, absolutely. Now, at the beginning, lots of people were quite worried that these things seem to be being rolled out a bit too soon, potentially, because as you will have read, the Oxford vaccine was developed in 10 months as opposed to 10 years, which it normally takes. So this was obviously a heroic effort to get this vaccination out with this small amount of time. But the good news is scientists already know a lot about other coronaviruses, and they've had this type of technology for almost 20 years now to make other vaccines against other types of viruses. So, for example, influenza and other types of coronavirus, for example, the Middle Eastern Respiratory Syndrome or MERS. And this technology has been shown already in loads and loads of trials to be extremely safe. So that's really reassuring. Now, the other thing is, before any vaccination is allowed in this country, the MHRA, which stands for the Medicines and Healthcare Products Regulatory Agency, they're an independent group who look at all the evidence for the safety of vaccinations and other medical products. And both of the trials of the vaccinations in this country, in the case of the Pfizer one, there were more than 43,000 people in trials of the vaccine, and 20,000 who had the Oxford AstraZeneca vaccine, and they were both shown to be very, very safe. And there are similar regulatory agencies in the EU and the USA as well. So there can be no doubt that these vaccinations are safe, other than the tiny proportion of people that I've already mentioned who've got a severe allergic vaccination. So everyone should definitely have the vaccination, as it's much safer for people than risking a severe COVID infection. And that includes everybody with arthritis, everybody on disease-modifying drugs, including methotrexate, everyone having biologics, and everyone who's clinically vulnerable. So don't be scared. This is safe stuff.
That's really good news. Thanks, Wendy. Why are some people reluctant to have the vaccination?
Yeah, this is interesting, and it was a bit surprising to me, but understandable. There's a lot of frightening stuff on social media, and I think a lot of that has caused many people to be worried about this. So first of all, there's lots of misconceptions about the virus out there, the vaccination, sorry. The vaccination doesn't contain any animal product, so it's not got gelatin or pork, so it's safe for people, or it's fine for people who've got religious objections to those things. It's also not made from embryos at all. So embryos are not involved at any stage of this, and it's entirely made in a laboratory. The vaccination can't turn anyone into a monkey. This slightly made me laugh, but there is some stuff on social media about this. It does not contain monkey cells at all. As I've already said, the Oxford vaccination uses an altered part of a chimpanzee cold virus, not chimpanzee cells themselves, but a virus, a cold virus. So it's not going to turn anybody into a monkey. And also it doesn't contain any alcohol, so nobody needs to worry about that aspect of it.
Okay. What about the new variants? Will the vaccinations work against these?
Yes, they will. We've had a lot recently, haven't we, about mutations in viruses, and that word mutation, it sounds really, really scary. But the fact is that all viruses mutate all the time. It's been estimated that the COVID virus mutates once or twice a month, and that means that they change their shape or their structure very, very slightly. And that's why we need a different flu vaccination every year, because the virus just changes every so often. So luckily, this is such a nifty piece of technology, is that scientists already know the genetic code for the COVID virus. They've known that for the last year. And once they know the code, they can predict exactly what might happen if the virus mutates. And there are thousands of possible mutations here, but the scientists know about every single one of them, and they can therefore predict what's going to happen, and they can be ready to make tweaks to the vaccine, if you like, to protect them. So to make new versions of the vaccine. So none of these mutations are in any way unpredictable or scary. Now, all the current vaccinations work really well against the original COVID that came here, and also the Kent variant that we found just before Christmas. The South African variant and the Brazil variant is slightly more worrying, because it's got more than one mutation on the spike protein, which could potentially mean that it could mean the COVID virus could hide from the body's immune system. So, but however, small trials have shown that the Oxford vaccination may be less effective against mild and moderate COVID, but we will still protect against severe disease. So obviously we need more research, but the trials so far are encouraging that they will still protect against severe disease. So the great news is that scientists can keep ahead of any mutations by developing new vaccinations, which are much quicker to produce than the original. So we won't have to wait a year for another vaccination, but we may need yearly boosters, and watch this space.
I didn't realize that. That's very exciting.
Mm-hmm.
And what can I expect when I go for my vaccination?
Okay, so first thing to remember is that the vaccination is always free. So if somebody phones you up offering you a vaccination for money, or bangs on your door saying, I've got the vaccination here, give me some money, that is not the NHS who are contacting you. You'll never be asked to pay, and it is free. So if somebody does that, please phone the police. It is a scam. So now everyone I've spoken to who's had the vaccination has been incredibly impressed about how organized the whole system is. So there's a greeting area where you will be met. It's often a large room with tables, and a recovery area where you can have a drink afterwards. And there's a one-way system. So these places feel very safe and well organized. So an admin person will note that you've arrived at the centre. You'll sit down, usually on your, unusually for the NHS, this works according to time, which is amazing. So you'll sit down at a desk, and you'll be with someone who'll be wearing a mask or visor, and you'll be asked some questions about your general health. For example, if you've had a temperature, if you've got any allergies, or if you're taking any other medicines or antibiotics. If you've had a recent COVID infection, you will need to postpone your vaccination for 4 weeks so that you'll have recovered and that will be more effective. You won't need to take off any clothes. You'll just need to be able to expose the upper part of one arm, usually the one that you don't write with, and there'll be screens and curtains to protect your modesty. It's all very private. If all's well, you'll be given the jab in the top of your other arm. It's a teeny tiny amount, so it doesn't hurt much. And then you'll be asked to wait 15 minutes to make sure you haven't had a reaction. Sit down, have a cup of tea and a biscuit, and then you're all good to go, and you can go home.
Thank you. Once I've had the vaccination, can I go and see my family and friends?
Sadly not immediately. So it's going to take 2 to 3 weeks for your body to start reacting to the vaccination and to make enough antibodies for you to be protected. So you will not be immediately protected from this, and you will still be at risk of COVID certainly for the first couple of weeks. So the other thing is that scientists don't know how effective the vaccination is at stopping you from spreading the virus. So it could still be on your hands, or it still might be in your nose. And so some other people may still be able to catch the virus from you. So we're all going to still need to be very careful for some time, even after 2 vaccinations.
Okay. My immune system is already weakened by my arthritis and my arthritis medicines. Why should I have the vaccination?
Okay, that's a good question. So we know that people who've got active arthritis that isn't under good control, or people who have a weakened immune system due to medicines, they are at much higher risk of serious complications from COVID infections. And this is completely preventable with the vaccination. And in addition, the vaccination will not weaken your immune system anymore. If anything, it will strengthen it. So you should go ahead.
And why is the UK giving the 2 vaccinations 12 weeks apart rather than 3 weeks apart as they do in the US and Europe?
So the government and scientists made a decision at the beginning about this, and they knew that 1 dose of the vaccination already gives protection from catching COVID for at least 12 weeks. And just a new study has just come out this week about the effectiveness of 1 dose in patients in Scotland, and they have found that 1 dose is extremely effective at preventing people from going into hospital, more than 85% effective for those groups of people. So we know, as the evidence comes in, we know more and more that it's safe to give the 2nd dose at 12 weeks rather than at 3 weeks. There was some anxiety at the beginning about that. So there's some evidence that the Oxford vaccination is more effective if given this way. And in addition, giving the vaccine at 12 weeks apart means that more people can be protected from severe disease, and that this will in the long run prevent the most deaths.
That's really good news.
Yeah.
I've had COVID-19. Do I still need to have the vaccination?
Yep, that's another good question. So having COVID-19 definitely does offer protection from getting another COVID infection for a while, but no one knows how long that protection lasts or how much protection any individual will have. So in other words, will it protect you from severe disease or just mild disease? So it's very important to get the vaccination so that you can be protected as much as possible. And the good news is that in studies of healthcare workers who've had the infection, 6 months after the infection, about 88%, almost all of them, still had antibodies in their blood to COVID, but no one knows how much protection these offer.
So is it safe to have a steroid injection or to start methotrexate before the vaccination?
So, as I said, it takes about 2 weeks for the first dose of the vaccination to produce enough antibodies to be able to fight the infection. So at the moment, experts are saying that if you possibly can delay a steroid injection, either in a joint or into your muscles, or if you can delay starting methotrexate or another disease-modifying drug, please could you try and do so for a couple of weeks after the vaccination, because that will make the vaccination more effective for you. However, if you are in desperate need for steroids or any other treatment because your arthritis is severe, then clearly you can't just hang around for weeks and weeks if you're feeling terrible. So don't delay treatment for the vaccination, because having arthritis, which is active, is also bad for the immune system and will make you more vulnerable to COVID. So that's an individual decision.
Okay.
Now, the only exception for this, really, I'll talk about this a little bit more later, is for rituximab, which does reduce the effectiveness of some vaccinations. So it's suggested that rituximab should be postponed for at least 4 weeks after the vaccination, or people on rituximab are switched to an alternative medicine. So, however, if you've got a life-threatening condition, then rituximab should not be postponed.
Okay. I am a non-paid care for my disabled partner. Can I get the vaccination sooner?
Yes, you definitely can. Now, you will know that there are these priority groups that the Joint Committee on Vaccinations and Immunisations, or also known as the JCVI, have worked out who should get the vaccination first. And we're already way down the list of priority groups. I think we're doing probably into the over 65 age group now. If you are a non-paid carer for someone who depends on you and who might not be able to cope if you were to become unwell with COVID, then the committees say that you should be in group 6, which is just about now. And so you will be prioritized, but you have to register as a carer with your GP surgery so that they know who you are. You won't get a letter, but you will be able to get an earlier vaccination.
Excellent. Should I delay my methotrexate or other arthritis drugs for a few days around the time of the vaccination?
Yeah, that's a good question, and we've had lots of questions about this. And the bottom line is that we don't know the answer to this question yet, so there hasn't been any guidance. But many arthritis drugs work for a very long time and are in the system for days or weeks or even months. So common sense suggests that it's not logical to stop them for a few days around the time of the vaccination, as it will still be in your system, but we don't know.
Okay. Should I delay planned surgery because of the vaccination?
Yes. Now, current advice is to delay surgery for a week after the vaccination. And this is because both the vaccination and surgery can cause you to have a temperature. And if you have a surgery and then you have a temperature, then surgeons will think you've got an infection, so they'll go hunting for an infection. So it may well lead to unnecessary tests. So wait for a week.
Okay. Thank you so much, Wendy. We'll now spend some time answering any questions you may still have about the COVID-19 vaccine. I've noticed a few hands going up in this, so if you just remember as a reminder, if you go to the Q&A button at the bottom of the screen and type in your question, we'll be able to take a look and answer as many as we can fit in before the end of the session today.
Great, thanks, Shan. I can see there's absolutely loads of questions there, so I'm going to try and get through as many as I possibly can. Some of them are grouped into themes. So first question is, what should I do if I haven't had my vaccination letter? Yes, that's a good question. So obviously, with millions and millions of people being sent letters, there may well be a few that have gone astray. So if you're in one of the priority groups and you haven't had a letter, there may well have been a mistake. So, or it may be that your area is slightly slower than other areas due to a different population. But at the end of the talk, there's details of what you should do, including a website or calling your GP. And there is a phone number that you can call, which is 119. Okay, 119, somewhere between 111 and 999, which is 119, and that they will tell you what to do. Next question, do I have to go to a vaccination centre? It's a long way from home and I don't have transport. No, you don't. Firstly, some taxi services are offering free transport, so you may well be able to check with your surgery if somebody can help you get to a centre. But if you can't get there, or you're nervous of going there, or you prefer to go to your GP surgery, don't worry, you can choose to do this instead, and you will get your invitation letter to go to the surgery at some point. So GPs will know who has and who hasn't had the vaccination, and they will invite you later on. Okay, I have next question. I've been shielding and I've now had my first dose of the COVID vaccination. Very good. When will it be safe for me to go to work in a customer facing environment? Yes, lots of people are asking that question. So nobody quite knows. It very much depends on your individual circumstances. So if you are very vulnerable, very immunosuppressed, you may choose to wait until you've had your second vaccination or until further guidelines come out. PPE is likely to be needed for some time, but if you can go to work and protect yourself with adequate visors or screens or whatever, then yes, it probably is safe, but it may not be. It has to be right for you. So liaise with your employers. Now, there've been loads of questions about how can the vaccination affect arthritis medication, and the opposite of that, how medication for arthritis can affect the efficacy of the vaccination. So let's do some of those now. So first one is, I'd like to know how the vaccines interact with medication, especially disease-modifying drugs that already interact with T cells. Okay, so to answer that question, I've got to talk a little bit more about the immune system. I'll keep it simple. So T cells and B cells they're both types of white cells, also called lymphocytes, in the blood, that circulate in the blood in all of us, and they're both vital for fighting infection. So the B cells, the B lymphocytes, are the ones that make the antibodies to the virus or the vaccination. And rituximab is a drug that works against the B cells. So the B cells make the antibodies. The T cells are these really nifty ones that make memory cells, things called memory cells, that circulate in the blood after the vaccination, and they're ready to fight an infection when it next comes along. So after we have a vaccination, so most of us will have had a polio vaccination, we will all have T memory cells for polio that will be ready to fight the polio if it comes along. So now all the vaccines, all the COVID vaccinations, stimulate the production of B and T cells that are specific for the COVID virus. So these are only T cells for the COVID virus or B cells relevant to the COVID virus. You're right in that some arthritis drugs, especially one called abatacept, can affect the functioning of T cells, but these are T cells that are only relevant to rheumatoid arthritis. So they're not the same T cells as the COVID specific ones. So hopefully I've explained that the COVID vaccination shouldn't affect how well your arthritis medicines work. So that would apply to all of the arthritis medicines. Now, the next question along a similar theme is to what extent is medication used to treat inflammatory arthritis, such as methotrexate and steroids, influence the efficacy of the Oxford AstraZeneca COVID-19 vaccination? And the next one is, people with autoimmune conditions have not been included in any of the clinical trials. However, it's generally believed that the efficiency of any of the vaccines will be reduced. In other words, there'll be less antibodies. Are there any previous studies with other vaccinations that might give us an indication of how these people respond? Those are really good technical questions, and related to that, I'll do the answers in a minute. These are all connected. And next, what are the suggested timescales between treatments like rituximab and a COVID vaccination? Okay, so first of all, some arthritis drugs, especially rituximab, you're quite right, can affect how well the body responds to a vaccination. So, for example, people who have been given rituximab will definitely have a reduced antibody response to the annual flu vaccination and also the pneumococcal vaccination. This also applies to methotrexate and to some biologic drugs, but to a much lesser extent. Rituximab is the worst one for this. So for most people, it's recommended that rituximab infusions are delayed until the vaccination has been given. And that would apply to all vaccinations, not just COVID. So if you need to have a flu vaccination, you should have that before you have your rituximab, similarly with the Pneumovax. So you should delay the rituximab for at least 2 weeks so that the vaccination has a better chance to work. Similarly, if you're starting a new disease-modifying drug for arthritis, you should probably delay the start until you've had the vaccination for a couple of weeks. If, on the other hand, if you've already had rituximab, then you need to wait 4 weeks before having the COVID vaccination to give the vaccination a better chance to work. I hope I've answered that clearly. Okay, so next question. Is it recommended to leave an interval between an intramuscular steroid injection and receiving a COVID-19 vaccination? Linked with this, how much is known about the effects of the COVID vaccination on the immune system, and should we be taking supplements or improving our diet to offset these effects on the immune system? So we don't know about leaving an interval between an IM steroid injection and the vaccination. So as I said earlier, if you need one, go ahead and have it. But if you can wait, then wait. There's nothing much you can do in terms of supplements to improve the immune system or diet. Obviously, eating a healthy diet is very important for the immune system. So that means eating plenty of fruit and veg, not avoiding smoking if you can, not drinking too much alcohol and stimulants. But there's no evidence that any supplements can actually boost the immune system, improve the response to the vaccination. There's been a lot of stuff about vitamin D, but these trials have not been conclusive so far. However, most of us haven't been going out very much this whole last year, so most of us should probably be taking a vitamin D supplement just for general health. Is there anything that can be done to improve the efficacy of the COVID-19 vaccinations? For example, skipping doses of immunosuppressive medication? No, as I already said, we don't know the answer to that one because drugs have a very long life in the body. So we don't know the answer to that one. Right, the next set of questions are all about, this is an interesting questions about how having COVID-19 infection or how having the vaccination might affect people with arthritis. And we've got some sets of slightly opposing some questions here. So first of all, how would the vaccines affect arthritis, either for prevention or cure? And here's somebody else who sent in a question who might have actually answered that question for you. So following my first Pfizer vaccination, my rheumatoid arthritis has been in full remission. That's excellent news. Methotrexate and steroids have never done this. It feels like I've gone back 10 years in time. It's like my immune system is fighting something else instead of attacking my joints. So that's excellent. That's excellent and amazing news there. So it's known that after many types of viral infection, not just COVID, some people can develop a form of arthritis, which we call reactive arthritis. So for example, people who've had glandular fever or German measles or hepatitis B can develop what we call a reactive arthritis. And some vaccinations can also do this, so especially hepatitis B. COVID-19 infections have also been associated with reactive arthritis, but I haven't actually read any information about arthritis going into remission after the vaccination, but it sounds as though it certainly has for you. So that's great news. So hopefully we will get more reports of that. But I like the idea that your immune system is busy and therefore it's busy with fighting the or dealing with the vaccination. Therefore your arthritis has gone quiet. That's a nice idea. Now, two linked questions. My understanding is that people with autoimmune conditions have a high inflammatory markers in their blood. Could COVID vaccine increase the inflammatory marker, resulting in the person having a flare-up of their condition? A good question. And this is another person who said, I've had my AstraZeneca vaccine 17 days ago and I suffered 2 days of side effects, followed by flares and stiffness. Have other rheumatoid arthritis patients have the same symptoms. Yes, that's an interesting, both interesting points. So having the vaccination can certainly cause joint pains and stiffness as a side effect. So it's unclear whether or not it's a flare of the arthritis or if it's a reaction to the vaccination. So it's possibly a reaction to the vaccination rather than actually a flare in the arthritis. But anything is possible with the immune system, as you probably know. Now the next one is a question about long COVID. So I've just been diagnosed with long COVID, giving me problems with shortness of breath, severe fatigue. I understand that it affects muscles. So would that have a detrimental effect on the joints? I feel people already struggling with arthritis might have real problems. Yes, I agree. Long COVID is likely to be a problem for many people, and it's been estimated that up to 1 in 10 or even more people who have COVID may have symptoms lasting for more than a few months, especially fatigue and aches and pains. And this fatigue can be incredibly debilitating. Now, we already know that lots of viruses, so for example, glandular fever and hepatitis, for example, can cause severe post-viral fatigue, and COVID-19 is no different. So you're absolutely right that if we are inactive, this will weaken our muscles, and weak muscles can contribute to joint pain. But with severe fatigue, it's a real problem, because pacing your activities is really important if you've got fatigue. So if you push yourself to exercise, if you say to yourself, I must exercise, or I should, or I ought to, and you push yourself too hard before your body's ready, you're going to feel exhausted and you're going to feel worse. But at the same time, it's important to try and keep moving at the same time. So whatever you can do, even if you can only walk a few steps after having COVID, even if it's only 10 steps, walk around, just do that and build up very, very slowly. Don't push yourself too hard. Your fatigue will improve, but you've got to be kind to yourself and make everybody else be kind to you as well. So look at our website for more information about this and about managing fatigue. And the other thing is, people who are tired and in pain often feel very low and frustrated, which is of course natural. So looking after your mental health is very, very important. So again, go to our website for help on that. And I'm really hoping that the government will be rolling out some services for people with long COVID as soon as possible. Now, next, questions about the effectiveness of the vaccination. So these are all really good questions. Is one brand of vaccine better than another for somebody with an autoimmune condition? That's one question. Or next question, is a vaccine with a higher percentage efficacy more appropriate for immunocompromised patients? That's another good question. So now I wanted to talk about this because the headline efficacy of different brands might not reflect what actually happens in real life. And this is because obviously drug companies have a drug to sell. And so the way they do the trials may not be exactly the same between different brands of the vaccination. Now, for example, the headline efficacy for the Pfizer vaccination was 95%, whereas the headline efficacy for the Oxford one was 85%. So on the surface, it looks as though the Pfizer one is more effective. But when you look at the trials in more detail, the Pfizer trials did not report anyone who had a suspected COVID infection after the vaccination. And so that meant that a lot of people may well have had COVID and it wasn't actually reported in the trial. So it's likely that the real life figures for that Pfizer vaccination are in fact much lower. Now, the other thing is the trials were done on different populations of people. So the Pfizer one was done in America, where the Oxford one was done in the UK. There were different proportions of women. They were people who had a different age group, and they had different minority groups in those trials. So they're not at all comparable. So trial numbers do not necessarily reflect what actually happens in real life. And as I said earlier on, there's been a really excellent study this week from Scotland looking at the two vaccinations, the Pfizer and the Oxford one, showing that both are extremely effective in preventing hospital admissions. And very interestingly, that 95-85 number was reversed. So they seem to show that the Oxford one was potentially actually slightly more effective. So the headline is that both of them are extremely effective and probably equally effective in real life situations. So there's no advantage having one over the other if you've got an autoimmune condition or if you're on disease modifying drugs. So just go for whatever one you're offered. They are both equally effective. Now, this is a good question. I heard on Breakfast TV that a new vaccine is soon to be tested at Nottingham University. Absolutely, this is a really, really exciting one. So as I've already said, all the existing vaccinations work around the spike protein thing, the little triangles on the surface of the virus. Now, the virus has also got other parts of it that vaccines can be made from. So the surface of the football has also got some antigens or proteins on the surface of it. And this Nottingham University, this vaccination, which is gone through all the safety trials and it's just going to be trialed on humans now. This vaccination is based on an antigen on the football surface, if you like. And this is obviously going to be very useful. If the spike protein mutates, then there will be another virus that will work on a vaccination, that will work on another part of the virus. So all of this technology has been used all the time, and it's likely that in future vaccinations will carry. They're called multivalent vaccinations, or polyvalent vaccinations. In other words, they've got lots and lots of different targets that can be used, so that the virus can't escape, and we will be one step ahead of this virus at all times, which should be great. Now, I'm going to go to your live questions in a minute. So now this is a question about family and friends who are disregarding an immunosuppressed person's worries about COVID-19 and calling them a germaphobe. So in other words, family and friends are saying, don't be so silly, you don't need to be worried about COVID anymore. So and putting this person under some pressure to get a grip, essentially. That's what it sounds like. So now, and their question is about how can they cope with their family and friends who are saying they're a germaphobe. So firstly, this is very cruel of your family and friends, so they're not being kind. So facts are facts. And COVID-19 is extremely dangerous, as we know, and it's unpredictably dangerous for some people, and it's extremely infectious. And it's still a problem in spite of lots of people having had the illness, about 4 million, and in spite of about 20 million people being vaccinated. So it's still a problem. And as we know, reducing the lockdown at Christmas time led to this massive surge in infections. So in the case of my family, somebody brought it home from a supermarket trip and the whole family caught it. So it's very, very easy to catch. So you are absolutely right to be careful. If you're nervous because you're immunosuppressed, don't take any notice of anybody else. Just do your own thing. Be strong. Ignore the doubters. And the other thing is just reassure them that things will get back to normal, and you will do whatever it is they want you to do, but not just yet. Okay, so right, let's have a look at some of these live questions now, see if we can do some more of those. Okay, Jack, thank you. Had the vaccination last week, and only side effect was a sore arm for a few days. Brilliant. That's good news. And somebody else who said that right arm is bright red and painful. Don't worry, it's fine. It's just you're having a bit of somebody says they've had the vaccination and their upper arm is bright red and painful. Don't worry, I would probably take an antihistamine. You might have just had a little local reaction to that, like some people do with a wasp sting. Obviously, if it doesn't settle, go and take a photograph and show it to your GP, or go and see your GP. So someone's asked a question about N-acetylcysteine. Is a powerful antioxidant. Any feedback on this, please? Is it good for OA? I'll answer that one later. We're talking about the vaccination today. A friend has had the Oxford vaccination and has had a lot of the side effects for at least 2 weeks, with the last side effect having diarrhea without diarrhea. It's frightened me to have the vaccination. Okay, so some people are having side effects from the vaccination, but I must say that most of the patients I've spoken to that have had it, and they're obviously in the older age group, because it's the older age group are having it first, they're saying to me, don't be silly, it's no problem at all. Everybody's making a fuss about nothing. So please don't be frightened. Some people do have side effects, but that doesn't mean that you're going to have one. So please don't get put off. A question about rituximab. Has anyone been advised to wait 6 months? Probably not. Things are moving on with rituximab now, so I would just get some more advice on that from your department, because advice is changing. And has anyone with rituximab had their second vaccine 3 weeks after the first? We're recommending 4 weeks. So that's what the current guidelines are saying. There's something called the Green Book, which you can look at to give up-to-date advice. Hope that may or may not be on our website, but that's where you need to go. How effective is the second vaccination if your immune system is suppressed by arthritis drugs? The answer is, as I hopefully have already said, very effective. Can the Pfizer and AstraZeneca be mixed? Well, then that's not recommended at the moment, but I think the answer is we don't really know. It's probably safe, but we don't really know. But at the moment, it's not being recommended. Some more questions about sore arm and elbow. Yes. There's a question there about what's a live virus. It just contains it contains the genetic information from part of a virus. It is not literally alive, and it does not have genetic information that will cause the disease. So a live vaccination cannot, under any circumstances, cause the disease because it does not have the genetic blueprint that are essential for the disease. Done that. After 7 days have passed after your second vaccination, is it safe to go out and about again? No one knows the answer to that one yet. The trials aren't out there yet, but good for you. If you've already had your second one, that's good. Probably, again, the booster will give you that additional protection. And again, it will take your body 2 to 3 weeks to respond, but safe is a difficult thing. So just fair enough to go out, but just be careful. Are the side effects worse after the second vaccination, Pfizer? And if so, what can I expect? Yes, I've looked up this, having had my first vaccination, because I was a bit worried about was that true? And they're slightly worse, is what some trials are saying. But on the other hand, people I've spoken to have not reported that is the case. People have had the 2 vaccinations, said that's not the case. I've answered a question about vitamin D. If we are to have yearly boosters, will these be combined with the yearly flu vaccine? Nobody knows the answer to that. We don't know, but I would imagine that the logistical system that's already in place about the flu vaccine will certainly be used. I would imagine so. It's just that probably the boosters will apply to almost all of us again, whereas at the moment, not most of us don't have the flu vaccination. Does osteoarthritis reduce the immune system? No, it does not. I'm talking about rheumatoid arthritis. That's a really good question. So I didn't make that clear. Osteoarthritis does not affect the immune system. No, I didn't. I did speak about the Pfizer vaccine. It's called the Pfizer-BioNTech one. I did speak about that. That's the mRNA vaccine. It's a good question. Some people have found what looks like an NHS booking service, but it's asking for your NHS number. Is this a scam? Do you know anything about that, Shan? Have you heard about that?
I haven't heard about that, no. If they want to send us more details, we can look into it and ask around.
Yeah, please send us information about that, because I haven't heard about that. An NHS booking service may well ask for your NHS number, obviously, because that's how they identify you. But don't know. We'll find out about that, I think. Here's a question. We're nearly at the end of the question now. I've read a report from Diabetes UK stating that people with type 2 diabetes who take metformin might be at reduced risk at dying from COVID-19, and that might help prevent COVID-19. I'm not aware of that information. That's very interesting. Please send me. I'd like to read about that. That's very interesting. I'm not aware of that. I am shielding. Should my cleaner have the vaccine? That's an interesting question. Obviously, it's completely up to individuals whether or not they have the vaccination, and nobody can legally force anybody to have the vaccination. The question is, do you want somebody who hasn't had the vaccination coming into your house? And that's quite a difficult one, isn't it? Because obviously you've got a personal relationship with that person. That's quite challenging. And would this come under the carer category? No, no, it wouldn't. Employees are not carers. Carers are carers. Here's a question about anti-inflammatories. Should we delay anti-inflammatories and steroids each side of vaccination? No, is the answer to that. There's another question about waiting 6 months after, that's Ian again, thank you. Waiting 6 months after rituximab treatment to have the vaccine. I think you need to do a bit more research on that one, Ian, because that does not fit with the guidelines at all. You need to go to the Green Book to check. So the advice, if you've had rituximab already, it's 4 weeks. So please check. Whoever's told you that is not correct. It's a good question here. Does a person who've had a severe reaction to the vaccine have more or less immunity to someone who has no reaction whatsoever? That's a really good question. And that would apply to COVID as well. In other words, if someone's had a very bad COVID infection, are they more immune than someone who hasn't had any symptoms at all? Don't really know the answer to that question, because some people's immune system is busy in a quiet way, and some people's immune system is busy in a more noisy way. So don't know the answer to that. All we know is that the vaccination is very effective. I think that is it for, oh, here we go, Jack, thank you. Are side effects more prevalent in men or women? I would like to say, I know some women or carers who have been affected. One carer refuses to have the vaccine because she thinks her immune system can fight it. I don't think we know if side effects are more prevalent in men or women. I haven't read that. Haven't read that in the trials. So I don't know the answer to that for sure. And again, the question about a carer not having the vaccination is a very, very, very tricky one. I'm surprised they're not. I'm surprised that they haven't had it. But again, you can't force them to have it. But really, should they be caring for somebody who's immunosuppressed if they haven't had the vaccination? I would suggest probably not. If you have a flare of osteoarthritis, is it safe to have the vaccination? Definitely. Yes. My GP surgery is doing the vaccines. I was told the second one will be 12 weeks later. You just said between 3 to 4 weeks. No, I didn't say that. In general, everyone's having the second vaccination 12 weeks later. There has been some advice that some people who are starting disease-modifying drugs could have their second dose a little bit quicker, but nobody knows the logistical process to make that happen at the moment. So I can't give you a definite answer on that. So at the moment, everyone's having it 12 weeks later, unless there are special circumstances. Last question now. I had no reaction at all from the vaccination, not even a sore arm. Well done. Am I still protected? Yes, you definitely are. Well done. That was great. You didn't. So lots of people having no side effects at all from the vaccination. Okay, so that's it. I think we're out of time now for the questions. Anything I haven't answered, I will most definitely answer later on. I think it's back to you now, Shan, isn't it?
Thank you, Wendy. We've definitely kept you very busy today. You've had a very busy hour. We really appreciate that. I'll just share the screen again. So everyone has our information. And again, we mentioned there, if you've come across some things you'd like us to know, please feel free to contact us. So you can send an email or give us a call, and all the details are there if you don't have them already. So thank you so much, Wendy. This concludes our webinar on arthritis and the COVID-19 vaccine. If you'd like any more information on the subject or anything else relating to arthritis, please visit our website at arthritisaction.org.uk. We have a number of useful resources that will help you self-manage your condition, including detailed information on exercises, dietary information, well-being resources, and tips on staying connected. We also have a dedicated website section on COVID-19 advice and information, which is updated regularly to reflect the latest government guidelines and advice. A video of this webinar will be made available shortly on our YouTube channel. We will send you an email with a link to the recording once it's available. all that's left for me to say is a big thank you to Dr. Wendy Holden for answering our questions today. And thank you to everyone for joining us today during the webinar. We hope you all stay safe and healthy, and we look forward to hearing from you soon. Thank you so much, everyone. Have a wonderful day.